Yes, it is all about the children, even after they're born. Rick Smith.
Welcome back to the Rick Smith Show. So you may remember back in March, Joe Sestak, give him credit, man, got the walking shoes on 422 miles across the Commonwealth, shaking hands, kissing babies, doing all of that stuff. And like I said, I give him credit. Back doing the same thing. You may remember we talked about his book, Walking in Your Shoes to Restore the American Dream. This is the kind of politics that I wish we could get back to. Instead of all of the moneyed interests controlling things, actually shaking hands, meeting people, seeing what's really important, which is why I've asked Joe to come back, talk with us a little bit. Joe Sestak, thanks for taking time for us.
Great to be with you, Rick.
So, like I said, I give you credit for this, and anybody who does the hard work of knocking on the doors and all of the, what I call grassroots politicking. So I give you credit for that.
Thanks. Look, it is about people, and I believe we're in a fight for the soul of America, and that's we, the people, from which those three words that begin our Constitution. Our Washington, D.C. legislators are not taking care of people, the working family. So I walk those 422 miles across this state, doing an event every day, whether it was on Paycheck Fairness Act for women, or whether it was about working families and getting wages rising again. I want people to know I'll walk in their shoes, not just here in Pennsylvania, but down in D.C. to fight for them.
Yeah, I mean, because what we're seeing coming out of Washington, and I think a lot of people look at it, the dysfunction that's there. I blame it on the moneyed interests and how you've just had this corrosive effect that money has had on our process because we're not doing the will of the people. When the majority of folks are saying we want to strengthen Social Security, we want to close the inequality gap, we want to raise the minimum wage, do all of those things, and yet nothing gets done, I think people get frustrated.
I think you're absolutely right about the moneyed interest. Look, when I left Congress, I did not do what 435 other congressmen and senators, including Senator Toomey, did when he left Congress, take a lobbying job. And let me tell you, those goes up to 7 figures. I went back to teach. Imagine those congressmen and women down there just waiting near the end of their terms to say, well, now I'm going to be a lobbyist. I better make sure that I don't offend anybody, not of people, but of lobbying firms. No, I think you take money out of politics, you'd fix 80% of our problem. Too few people will stand for people. Too few politicians will stand for people. They'll also be too affected by the moneyed interest.
Yeah, I keep wondering where John Boehner is going to end up. What kind of lucrative gig he's gotten himself. But let's talk about why you're doing this. I mean, one of the I like the issues based. I like the idea of talking about policies. And one of the things that's frustrated me is I don't think we've done enough for our veterans. Look, I was against going into Iraq. I was against the misadventures over there during the Bush years. But I said from the beginning, while I'm against it, you have to be for the people that were put in those situations, and you have to take care of them. And one of my frustrations is I grew up during the 70s where the guys coming back from Vietnam were just dumped back into my housing project. I never wanted to see that again, and yet I'm hearing stories that we're doing that with some.
Without a question. Look, every year on Veterans Day, I go into a prison to visit vets, to speak to them. And so many ended up there, not through their own fault, but because they came home. And after Vietnam, for example, as you mentioned, we pushed them to the side. We didn't even recognize what PTSD was back then. And all of a sudden there was 2 recessions, and then they're, into drugs, and all of a sudden they're robbing for that, and they're in there, rather than taking care of our human capital when they came home. So that's why a chapter of my book is on this. Look, we had a bipartisan bill that was voted down, including by Senator Toomey, who filibustered it because they did not want to take care of the mental health of our veterans. That was just a year and a half ago that they voted this bipartisan bill down. Look, how about jobs? When they came home, unemployment rate was 3% higher for our vets. Why aren't we doing what Texas does, where they actually have, every time a veteran gets out of service, its honorable discharge is sent to this office if they're from Texas, and if they have an unemployment claim they put in, that unemployment claim goes to this office, and they have 23 Iraq and Afghanistan vets that are there tied up with businesses who are looking for vets, and they just, on the ground there, tie vets into a job. That we need that type of an approach to take care of our vets.
And the other part of it is, the healthcare. The other part of it is, I get a lot of pushback, and maybe you can talk a little bit better about this than I can, but I get a lot of pushback about the healthcare system because in the news, we keep hearing that it's subpar. We keep hearing all of these horror stories, and I keep going back to this is the result of, probably 20 years of defunding the TRICARE, which is, again, one of these things that I think we should be strengthening, not destroying.
I've looked into this. I actually wrote an op-ed upon it. And there are places where the culture in the Veterans Administration has been permitted because of a significant underfunding during the Bush administration, starting with that period of time, that we did not let this culture of not taking care of our vets permeate. Right in Philadelphia, finally, we helped get a report out that showed that live maggots were actually found in the flesh wound of a senior veteran living in a senior veterans senior housing because they weren't being taken care of. But actually, when you look at the system as a whole, don't throw the baby out with the bathwater. Here's why. If you are a vet and go to a VA, your chances of having the proper diagnosis for chronic and preventive care is approximately 20% better. These are studies that have been done. In fact, there's approximately 60,000 deaths from misdiagnoses and others every year in our hospitals. Well, the chances of that happening in a VA are actually about 15% less. If you get in and you're into the correct, which are the vast majority of them, you do get better care. But there are changes that have to be done. Hold people accountable when they're not doing it right. And second, we've got to make sure that we just don't rely upon the VA. If you have a mental health issue in your community, why trek down to city of Philadelphia when you can have the private industry help you with oversight in the community by the VA so you can have the care of you taking care of mental health within the warmth of your community. Those type of changes, which I submitted a legislation for when I was congressman, need to be effected to make the VA better.
Yeah, I'm with you on the making it better, but here's my problem with some of that, though. I mean, once you start opening that door, then you've got those forces that want the whole thing privatized.
That is correct.
And that's a concern to me because then you start putting a whole profit motive in, and now you're really not talking about the issues that we were focused on. It becomes another one of these profit-generating operations.
Rick, you are spot on. And here's why. As you noticed, mine was a pilot program, and it was focused primarily on mental health, where you don't have to trek from a rural community all the way down to a city that may be 50, 60, 100 miles away. By the way, Philadelphia VA didn't even have a parking lot when I submitted this in, a parking garage. So it was meant for those types who had to travel a large distance and or particularly mental health types.
Yes.
And you're right, you don't want this to be a slippery slope because the care in the VA, for example, after Katrina, they were the only hospital that was able to recover its records immediately because they were the first in the nation with electronic records. And there is great efficiencies and effectiveness in so many areas of the VA, just like I mentioned on those three statistics of preventive and chronic care, as well as a proper diagnosis.
You're listening to The Rick Smith Show. We're here with Joe Sestak, joesestak.com, the website. If you want to take a look at the campaign website, Joe's running for the Democratic nomination for the Senate here in Pennsylvania. Again, on another one of these walks, 422 miles in March. The book also, if you want to pick it up, we can get the book at your website, right?
That is correct, joesestak.com.
And the book titled Walking in Your Shoes to Restore the American Dream. And, that American dream is something that I fear has turned for many into almost a nightmare because we've seen wages going down over the last 40 years. It's not just one of those things that you go, I think it is. We've got the data to point it out. We've seen the opportunity of folks to climb from poverty into the middle class been diminished. And, I think a lot of that has to do with a minimum wage that's been allowed to shrink, a union density rate that's been allowed to fall, and also what we've done in re-regulating things to benefit large corporations over small businesses.
Look, you are spot on. We know that the medium income for American working families, the exact middle income for American working families, is $1,200 less today than it was for a working family in the middle of all incomes back in 1999. That means over 50% of our American working families today are earning less in income, including benefits, than they did in 1999. And we've had an increase of partners, spouses that are working in these working families now. No, that's so unfair. Why does productivity that goes up about 2.5% every year, why in the mid-'80s did it all of a sudden, instead of having half the share go to labor and half of it go to capital, why did it plateau out and all of it goes to capital? None of it goes to labor. That's the change we have to bring about because of the issues you brought up. That's why the minimum wage has to be raised. What are we doing when today's minimum wage is like 1/3 less than it was back in 1968, and 2/3 of those who are actually on minimum wage are women, and 2/3 of them are working moms?
You know what I heard the other day? I've done one of these Republican focus groups on labor issues. And I actually heard the person making the anti-labor points saying that we don't need to raise the minimum wage because we have heavily subsidize the minimum wage worker. And I'm going, well, one, we shouldn't be heavily subsidizing it. And well, we shouldn't be subsidizing, but we're not subsidizing them heavily. Your work should be what you should be able to support your family on. And that's where we should be making that wage. But I thought it was ironic that a anti-government type was making the argument that we shouldn't be raising the minimum wage because government's taking care of all these people.
You know, I'll tell you who we're subsidizing, and that's the large corporations like Walmart. The
Absolutely.
average Walmart store has about 300 employees. Because they're paid so little, we actually, the taxpayers, pay part of their wage because about $3 million of Medicaid benefits, of health benefits, go towards those employees because they qualify for it because corporations aren't giving them a fair wage. That's who we're subsidizing.
Absolutely.
is large corporations. And when the productivity, all of it, that goes up 2.5% a year is going to capital, then something's not right, and we have to get it fixed. And that's why I walked through across this state, and one of those days, in those 222-mile trek, I did an event on minimum wage and raising all wages, and that's what we have to do.
So
Let the labor fair share come to the working family.
I'm with you 100%. Back you on that 100%. So as you're out walking and talking to people, because you're back doing another trek, and I understand you're going to be doing another one here. You're going to be in Indiana County, I guess, what, day after tomorrow?
Tomorrow.
Tomorrow. Okay, I've got the 15th here. Okay.
Oh, no, you're right. It is the 15th. I'm so eager to get out there. It is on Thursday.
Okay. But, you know, as you're out there and you're meeting people, because this is what bothers me, and I'll lay it out for you real quick. The New York Times just had a piece the other day talking about 158 individuals have funded over half of the presidential campaign so far. And you wonder why we don't have policies to increase the minimum wage and tax the very wealthy and strengthen Social Security and Medicare and do all of these things that I think all of us agree on, or at least a large number of us agree on. So when you're out there and you're talking to people, do you get a sense of that there is some common ground? Because it looks like our politics are so divided and we're so polarized. Do you get a sense of when you're out there on the ground talking to people, as I do, that there are places where we agree?
Without a question. Look, when I was doing that 422-mile walk, I'll never forget walking through Palmyra, and all of a sudden a gentleman walked out from a car dealership, and he yelled out to me, and I had my bombardier jacket on. He said, "Admiral Sestak, I love what you're doing, and I'm a Republican." Look, I represented a Republican district. It was approximately 57% Republican, 35% Democrat. I won my first race, yes, having to raise about $3 million. My second race, I won by 20 points. And although I raised that amount, you know how much I spent to win? $28,000 on yard signs. That's
Wow.
it. Because we kept the office The government office open 7 days a week. 50 interns under my staff rotated through. You could come into my office any day of the week from 8 morning to 8 at night, except Sundays, noon until 8. We handled 4 times the constituency cases as the average congressional office. And all of a sudden, Republicans, Democrats said, I may not always agree, as a Republican said to me at a poll, but you took care of my neighbor who had a child who had autism and wasn't getting a fair review at the school board. That type of approach, bringing people together and where they can come together on issues of the common family, autism, raising wages, and presented it in a way that says this is us in the Commonwealth of Pennsylvania, the United States of America, is what this nation is yearning for.
To me, that's what we need to get back to. The governance of we the people and contact with. Because we hear people say, we need to shrink Congress, we need to shrink Harrisburg, we need to have less representation. I go, no. We should probably be going the other way so that we have more contact with our elected officials so that they know our names, they see our faces,
Absolutely.
And they do what it is that we need to have done as a nation. To me, it's that simple. And I think what you're doing, fantastic stuff.
Absolutely, and thank you for that. But absolutely, what you said is so spot on again. Look, I'll be doing this, I'll go into Homer City in Indiana. I'll walk after doing an event on vets, and I'll walk over about 7 to 8 miles until I come to a small business called Indiana Vac. A 20-year-old young man owns it. He started at 18 while he was in high school selling vacuum machines because he was a repairman who learned it in Votech, and he's becoming the entrepreneur we need. And I'm never going to forget him when I go down there to Washington, D.C., hopefully to represent the people of Pennsylvania. This really is about we the people. I believe in a government that doesn't interfere with my individual freedoms of speech and press and speech, but I also believe in a government that can be ambitious in furthering our livelihoods, extending our freedoms through education, through medical health care, that can actually help us to be all we can be. That's the kind of balanced government I believe in.
There you go. I'm right there with you. The book, Walking in Your Shoes to Restore the American Dream, Joe Sestak. His book, you can get at joesestak.com or just go to thericksmithshow.com. Click on Joe's name, take you right there. Admiral, I appreciate you taking a little time for us. As you continue on your journey, please come back and talk to us again.
I'd be so happy to, and thanks for giving me the opportunity to talk to Pennsylvanians.
Anytime. Thanks so much, Joe.
Take care.
Let's take a quick break right back after this. Stick around. You're listening to The Rick Smith Show. We're working people. Come to talk.
Controversial, thought-provoking, opinionated.